tongue ties are just a myth. They are not something you need to be worried about, and they're really just a way for dentists to get rich. And don't even get me started on lip ties. Those are a joke. Have you ever been told these things? Because I definitely was when I was going through some issues with my second child and his tongue tie. If you are having any suspicion of a tongue tie or going through this yourself, you aren't going to want to miss this video all about my experience with 2 tongue-tied babies. My name is Katie Clark, and I am a certified lactation educator and a certified breastfeeding specialist. I'm also an IBCLC student, and I have a huge passion for educating and supporting moms throughout their entire breastfeeding journey. I also have a big passion for helping moms that are experiencing breastfeeding pain, because I have personally experienced this myself and I know how difficult it can be. In this video, it's going to be a little bit different than my typical ones. I'm going to get a little personal and tell you about my experience with 2 tongue-tied babies and the experience versus nursing one without getting it raised and nursing the second and getting it released right away. With my second baby, he was born at 39 weeks. He was very small due to being IUGR, but he did nurse right away. He latched and we went on our way. However, within just 24 hours of getting home, I was in excruciating pain. I had to clench my fist and dig my feet into the floor and bite my lip just to get through that entire breastfeeding experience because it was so miserable. With my first, I didn't have any issues, and so I hadn't experienced this before. I didn't know what was going on. I had heard about tongue and lip ties, and I knew that they were kind of controversial. So I kind of looked at his lip and it was very tight. I couldn't pull it up over his nose, but I brought that up to his doctor and she just kind of dismissed it. We went on with some other concerns that she had. That's a whole other story. But after that, I was still in so much pain, so I went to a breastfeeding support group. I brought up the tongue and lip tie thing, and immediately she told me, oh, that lip ties are not a thing at all. Tongue ties, he doesn't have one. He does have a high palate, but it's just a way for dentists to get rich. So that's not what's going on. She gave me some advice. Some of it was helpful, but for the most part, I went home and the issues continued. I was in so much pain. My son had very slow weight gain. I was having mastitis and clogged ducts, and he was clearly not transferring the milk well. At the time, I didn't realize this, but now, after all my experience and just learning a lot more about lactation, it was very clear that that was happening. He was not latched well. He was constantly wanting to nurse, and it was just a really difficult experience. I still felt like something was wrong, so they referred us to an ENT, who I went in and I was like, well, I think I heard it could be maybe a posterior tie that's not as visible. And he's like, oh, I've never even heard of a posterior tie. If anyone's telling you that is that is something, it's not. And I was like, okay, well, I guess I'll just keep nursing in pain and having all these issues. And our doctor was like, oh, your milk supply your milk is just not fatty enough. That's why he's not gaining weight. He has reflux because X, Y, and Z, or there's just all these other things going on, and it's not a tongue tie. Those things don't exist. So I just went on my way. Eventually, my milk supply did come back, and he started gaining weight better. We had to go through a lot of different, triple feeding things, and it was a very frustrating experience. But he did start gaining weight, and so I was happy, even though I was in a lot of pain. When I started learning more about oral restrictions, because I was like, something was not sitting right with me. And I was like, I just know something's wrong, because breastfeeding shouldn't be painful like this. And so I started reading more, and he had all of the signs of an oral restriction. So I got a referral to a pediatric dentist in our area that was highly recommended for oral restrictions in infants. We brought him in, and he kind of talked to us. He did a feed observation. He did an oral exam, and he's like, yes, he definitely has a lip tie, and he definitely has a posterior tongue tie. And he kind of he showed us the function, how it's not necessarily the appearance, but the function of the tongue, and why that was probably why I was experiencing the pain I was, and why, we'd had so many issues. At that point, my son was 6 months, and he was finally gaining weight well, that I was like, okay, I know that, because the dentist told us that he would probably have to relearn how to nurse, and since he was older, it might take longer time. And at that point, I was so done with the breastfeeding issues that I just kind of was like, okay, I'm just going to keep nursing. It is painful, but at least I have this experience telling me that the tongue tie was actually there. So I continued nursing. There were some times where it was less painful, but until I weaned him at about 2, it was a very painful experience for the most part, especially with teething. His latch was just not good. And so once he got teeth in, they were always just digging into me when I was nursing, and I was just in a lot of pain. And some people are like, why did you keep nursing? It was so painful. And it was just important to me, and I wanted to breastfeed, and it was something I just kind of got used to. Even though it was painful, I just kind of was able to block it out. So he weaned at about 2, and I forgot to mention, he had sleep apnea and reflux this entire time, which are also signs of tongue ties. And that was really difficult, and he ended up getting some decay on his front teeth, which, people are like, oh, that's because he was breastfeeding at night. But in my personal opinion, I feel like it was probably due to the tongue and lip tie, because that is also linked. Anyways, he stopped breastfeeding. We moved on. I learned a lot more about oral restrictions during that time. Fast forward to my 3rd baby being born. He was born. He had a little bit of trouble latching in the beginning, but we were able to get him nursing enough that they let us go home. I saw a lactation person in the hospital, but we just kind of started talking, and she's like, oh, you know what you're doing. You're a 3rd-time mom. You're training to be a lactation consultant. And I was like, okay, whatever. He's like not nursing that great, but we'll just kind of go on. So I went home, and that pain came back. It was just this flood of memories came back of that extreme pain. And, again, I was clenching my teeth. I had nipple damage. I had, the creased nipples when he would stop nursing, and it was so painful. He was just a couple days old at this time, and he was actually not gaining weight well. So we went into our pediatrician. It was a new doctor, and she actually had a similar experience with her son where he had a severe tongue tie. And so she's like, I get some flack from this from other people, but I'm going to check. And he did. She said, he definitely has a tongue tie. You need to get that fixed. And I was so relieved that I had someone from the start kind of validating me in that. So I also saw a lactation consultant, and she confirmed my suspicion. She couldn't diagnose it, but she's like, I definitely think there's some tension. His suck is kind of weak, so take him in. And so I went to another pediatric dentist in the area. The one I had gone to previously was booked out, but I found someone that I was able to get in with the next few days. We went in. He was wonderful. He explained everything. He kind of explained his experience with the tongue tie, and he did an oral exam, and he was like, he definitely has a posterior tongue tie, definitely has a lip tie that's causing issues. Because one thing to keep in mind is that having the presence of a frenulum, especially the upper frenulum, isn't an issue. And even having a tongue tie or I think it's labial frenulum is not necessarily an issue, but it's the function. So that's why it's really important not to just look at how the tongue looks, but do an examination of what's going on in the mouth, because the function is way more important than the appearance. Anyways, he did that, and he's like, yeah, there's issues here. So he took us right back to my son, or to his office. He did a COT cold laser treatment where he just used the laser to laser under the tongue, the lip or the frenulum, and then the lip tie. The hardest part of that was honestly just holding down my son. He stopped crying within just a couple seconds, and I went back, and he's like, okay, I want you to nurse him. And they had this lovely little room that I sat down in, and I nursed my son. And for the first time, it was not painful. And I get teary-eyed thinking about this, because I started crying then, because I had forgotten that breastfeeding wasn't supposed to be painful, because I didn't even know what that meant anymore, because with my second son, it was painful the whole time, and I was experiencing that again. And then I nursed him, and the pain was not there. And it doesn't always happen that fast, but he was very young at the time, and I saw immediate improvement. So I just was like, you are amazing. I love you. You're the best dentist ever. So I went home, and he gave me the stretches, because the stretches are really important, but I didn't do them correctly. So within about 2 weeks, all that pain started coming back, and I was like, oh my gosh, I'm in so much pain. So I went back to him, and he's like, oh yeah, it reattached. And he's like, you need to make sure you get in there when you're doing the stretches. Don't just do it really softly. You need to make sure you're putting the pressure on, because that's going to prevent the reattachment. And so that's what I did. I did those stretches religiously for the next 4 or 6 weeks or whatever, and the tongue tie didn't come back, and I experienced no pain with breastfeeding anymore. My son gained weight beautifully. He was just extreme weight gain. Like, it was really good weight gain, especially compared to what we went through with my other son. He still had some other issues. He had some reflux still, but that did seem to resolve eventually. But this whole experience, just seeing that vast difference in my experiences, validated to me that tongue ties are a thing. I do think that they can be overdiagnosed, and I think that they can be underdiagnosed. It's a really tricky process. There's not a lot of training out there, even for pediatric dentists. I think that a lot of them are trained in what ties are, but a lot of them just kind of look at the tongue. They don't do the oral assessment. They don't ask you how you're feeling. They don't do a visual assessment. So, and then the same things with pediatricians. Some of them are very trained, like mine was experienced with it because she went through that herself, but a lot of them may not have that experience. So it's really important to find somebody that doesn't just tell you what you want to hear, but that does that full examination, where they, start with a lactation consultant and they can do the examination and kind of give you an idea and do a suck assessment, and you can start there, and then you can go to a pediatric dentist or an ENT that is recommended in your area, and they can do a further assessment and talk to you more. The most important thing is that people are listening to you. If you are in pain, if you are having the signs of a tongue or a lip tie, and people are telling you, oh, those aren't a thing, or it's just a little tongue tie. Sometimes the worst restrictions are the ones that are the posterior, the ones that you can't see. So much of it comes down to the function. One thing that I also did that I found was really beneficial was going to cranial sacral therapy. They did, she was a CST, she did body work on my son's mouth, and it just released so much pressure and tension in his mouth. The tongue tie relieved the pain, but after she did the work on his mouth, I felt he was so much more comfortable, and there was so much less tension in his mouth at the breast, that it was just an overall better experience. So that's one thing to always also keep in mind. Some people actually will go to a CST or a chiropractor first when they start to recognize the signs of restriction, because not all ties need to be released. Sometimes there are things you can do to kind of help the baby use their mouth better. And so that's something that you can do, is just to go to the CST or whatever. There's a lot of great tongue tie providers in the United States. I have a link in the description for this video with just different links to Facebook groups for most of the states in the United States. I definitely recommend joining one of those to find recommended providers for releases. There's going to be, recommendations for pediatric dentists or for ENTs, for chiropractors, for body work and things like that. Because the tongue tie release is just the first step. You have to do stretches, you have to do suck training. You need to get that body work done. So it's really important when you are trying to find a provider to ask them kind of what their process is, what they recommend afterwards, and things like that. So I hope that this was helpful. This should not be taken as medical advice. I'm not trying to say, if someone tells you that tongue tie is not there, that it's definitely there, or that's definitely not there. And I think that, there's people on all sides of it. I do think some tongue ties are probably overdiagnosed. However, I really believe that it's important to advocate for yourself and to know the signs. Some of the common signs are, pain with nursing, a milk tongue because they're not able to elevate their tongue high enough to get the milk kind of scraped off when they're nursing, clogged ducts, low weight gain, just constantly pulling off the breast, sleepiness, reflux, sleep apnea. There are so many different signs of tongue ties, and just because your child has a frenulum, that doesn't mean there's a tie. If there's no other issues going on, you don't need to get something like that released. However, if you are experiencing issues, definitely find someone who's qualified in your area to help you. And sometimes it does take multiple people talking to multiple people to get where you're going. And I have seen with my own experience and time again with other moms that have gone through similar things, that tongue ties are real, lip ties are real. They are there. You probably hear about them a lot, and it might seem like, oh, it's just a fad, but that's because we're just learning more. And when we learn more and we know more, we're able to help more. And there's a lot of different courses of action, but I recommend working with a lactation consultant, with somebody who is very skilled in tongue and lip tie releases, because it is a skill that is is trained. It's not just looking at it. If someone's like, oh, they can stick their tongue out, there's no restriction, that's a red flag. They should be in the baby's mouth checking for it. Anyways, this is a little bit of a soapbox, but it was my experience and I think it's important to share. So if you have any questions, let me know. I do lactation consults as well with one of my mentors. You can check out the booking there if you need somebody, but I definitely recommend finding somebody in your area or doing a virtual consult with somebody to discuss your issues. And again, it may not be an oral restriction, but it might be. And so it's important to rule that out and to advocate for yourself and your baby. So if you like this video, be sure to subscribe for more and let me know if you have any questions.